Hello and welcome to yet another edition of your weekly international current affairs program, Globewatch, aired from the United States Embassy here in Yaoundé, Cameroon. At least $4 trillion, that is the amount of money spent each year on health issues by the United States budget, making it the first country to be an investor in the health domain globally. Over the years too, the United States government overseas has sponsored some of the greatest health initiatives with one key objective: serve as the best ambassador of the United States of America in reducing diseases that affect humanity, from pandemics such as HIV and AIDS, Ebola, Zika, malaria, and lately the coronavirus. Where are we with United States investments in the health domain, particularly at a time when the United States presidential plan, Emergency One, for the fight against HIV and AIDS and relief is celebrating 20 years? My guest today on Globewatch is U.S. Ambassador at Large at the State Department Coordinator of Pepfar. Ambassador John Nkengasong, thank you very much indeed for being guest on Globewatch. We are receiving you here for the third time, but this time in a different capacity. First of all, congratulations and welcome.
Thank you. Thank you for having me the third time running in your prestigious program.
Globally, the United States injects roughly $14 billion in health investment. That should be up from 5.5 in 2006. Why do you invest so much on health issues as a government?
The United States invests tremendously in health because we recognize that investment in health is investment in humanity, is investment in development, is investment in national security. And if you see what 20 years ago, how ugly the face of HIV/AIDS was in the world, GDPs in many countries in Africa had dropped by 2 percentage points. The deaths were all over. Hospitals were full of people that were just waiting to die because there was no hope. People were helpless. COVID taught us that a disease outbreak anywhere in the world is a threat everywhere in the world, and so it becomes a national security threat. That is why the United States believes strongly that health is worth. If we have to ensure sustained development, we have to invest massively in health.
And you spoke about Africa, a geographical area where U.S. health investment is roughly $100 billion. I'm using this, a currency that everybody can easily identify with. Mm-hmm. When you do health investment in Africa, is it in infrastructure, is it in personnel, training, or in other forms? In
the last 20 years, Charles, the President's Emergency Plan for AIDS Relief, which is the backbone program that has supported many countries in Africa to fight HIV/AIDS, has invested over $110 billion in several countries in Africa and outside of Africa. And each year, the program invests about $6 to $7 billion across member states on the continent of Africa for them to enable them to fight HIV/AIDS. Because we have to remember where we're coming from. 20 years ago, it was a miserable presentation. It was hopeless and it was helpless. And today, see where we are. You can hardly go into any hospital in Cameroon now and see a patient in the ward. That is remarkable. That is tremendous progress. That is what we mean by impact. The United States is determined to continue to supporting the government of Cameroon in its efforts to fight HIV/AIDS. Over the last 10 years alone, we've invested $650 million to fight HIV/AIDS in support of the leadership role of the Cameroon government. So that is tremendous, and we should really continue to work hand in hand to bring
We will
HIV
talk
AIDS
Cameroon in a moment, but let me just hang on one of the key flagship programs of the U.S. government when it comes to the health sector, which is, of course, the Presidential Emergency Plan for AIDS relief around the world, Pepfar, which is marking 20 years this year, launched in 2003 by the Bush administration. How unique is it in the U.S. soft power diplomacy, or if you like, health diplomacy, in solving health problems around the world?
The President's Emergency Plan for AIDS Relief, which is commonly called Pepfar, which was launched in 2003, has seen remarkable progress, and we are in 55 countries in the world. Most of those countries are in Africa, but we are outside of Africa. We are in Southeast Asia. We are in the Americas, because we recognize the call to action that was made 20 years ago to fight this terrible pandemic. As I said earlier, we've invested over $110 billion in supporting countries to fight this terrible pandemic. HIV/AIDS is not over yet, so sustaining the gains we've made through the Pepfar program in partnership with the Global Fund to fighting HIV, TB, and malaria, and the leadership role that each country has invested in moving this agenda forward is what we need to protect, ensure that it's sustained, so that we bring this fight to an end by the year 2030.
From my understanding, Pepfar is the single largest country investment in a particular disease.
Absolutely.
When you look at the results you have achieved over the past 20 years, do they speak to you that you have had an impact around communities around the world?
Pepfar, as you rightly stated, Charles, is the single most, I would say, massive health program that exists in the history of infectious diseases, fighting
by a single government.
By a single government, the United States. And the impact of after 20 years is remarkable. 25 million lives have been saved across the world since we started Pepfar. 5.5 million children have been born free of HIV/AIDS because of Pepfar. More than 2.9 million adolescent girls and young women have accessed comprehensive prevention services. And in terms of infrastructure, over 3,000 laboratories have been strengthened in Africa. Over 340,000 healthcare workers have been trained in Africa. And about 70,000 health facilities have been strengthened in Africa. And the impact goes beyond HIV. We realize now that each time there's an outbreak like Ebola, COVID, that Zika, that infrastructure that was used, that was established by Pepfar, is now routinely used to fight in other disease outbreaks. That is remarkable. We just need to look at where we were 20 years ago in terms of infrastructure, laboratory systems, healthcare workers on the continent, and to see where we are 20 years down the road.
What have you noticed now that you are heading this program as coordinator, as the challenges in implementing it in some parts of the world?
The challenges we see and continue to see in the fight against HIV/AIDS is the need to bring the whole of government together and the whole of society together. If the fight against HIV/AIDS was easy, it would have been defeated 40 years ago. You know, we've lived with HIV for the past close to 40 years. So it is that ability to understand that this is a disease that cuts across sectors, and to bring that multi-sectoral approach, including government, civil society together. That's why in our new strategy, the Pepfar strategy that President Biden launched on the 1st of December, we are looking at 3 components: the country leadership, the civil society, and the partnerships, so that we all work together to bring closure to HIV/AIDS as a public health threat by the year 2030.
A while ago, you started talking about Cameroon and U.S. health investments in the country, apart from education, political cooperation. when you look at what you have injected in the country, I'm talking about the U.S. government in particular, how much do you contribute to strengthening the country's healthcare system in terms of medications provision, in terms of health infrastructure strengthening, in terms of personnel capacity building?
No, first of all, let me recognize the leadership role that the government of Cameroon has played over the years in the fight against HIV/AIDS. And if you look at the graphs, it clearly shows you that considerable progress has been made in terms of number of people that are infected, number of people that are receiving treatment. As we speak, about 97% of people who are infected in Cameroon know that they are infected.
They know their status.
Their status. And about 92% of those people are currently receiving treatment. That is remarkable. We have to take it further because the goal is to ensure that 95% of the people who are infected know their status, 95% receive treatment, and 95% maintain their virus below detection level. We'll get there, and Cameroon is getting there. In terms of our support, over the last 10 years, the U.S. government has contributed over $650 million in supporting Cameroon's efforts to get to that goal that I just stated there. The common goal established by the UN Sustainable Development Goal is that we get this done in the next 6.5 years. That is by the year 2030. That's where we should focus, remain laser focused on the goals. The government should continue to increase its own domestic funding, which we are very pleased they have done over the last couple of years, but they need to take that further so that it matches what we are bringing in and also matches what the Global Fund is bringing in. That's the only way we are going to bring HIV/AIDS to a closure by the year 2030. I'll just say this, that we've shifted the dynamics, and the way we see new infections and the threat is among young people. It's among young people between the ages of 15 to 24 years old. And these young people didn't see the ugly face of HIV/AIDS 20 years ago. They were too young to know that there was a terrible disease going on. They don't feel that they are at risk. And even if they feel they are at risk, they know they can go to a clinic and get their ARVs. That's a threat. And if you, at the same time, you look at how the population of Cameroon is increasing, it tells us that we need to work aggressively to reduce the rate of new infections amongst young people so that as the population budges there, we do not get into a situation where rate of new infections catches up with the rapid growth of the population, especially amongst young people.
You have been operating in Cameroon over the years since independence, the U.S. government. One major health challenge came about 2 years ago, COVID-19, which redefined the dynamics of health cooperation. Is there any particular lesson that was learned in the way you spend your resources in Cameroon, either through CDC, the U.S. Center for Disease Control and Prevention, or through USAID and other agencies that work in partnership with your structures?
COVID taught us that from the United States perspective that it was need for us to cooperate more with the government of Cameroon. We exercised that cooperation through supplies of vaccinations. I mean, we were one of the largest suppliers of vaccines in Cameroon for COVID, in terms of diagnostics, in terms of surveillance there. And all those agencies...
About $120,000 in assistance to the Ministry of Health.
Directly to the Ministry of Health, not counting direct vaccine distribution. So the whole of government, again, is important. Those agencies that you listed, including the US CDC, USAID, and others, all contributed in several ways and different ways to ensuring that the support that we gave to the government of Cameroon actually reached the population and enabled Cameroon to bring COVID to an end.
In a moment, the interview will come to an end. But first, previously you were the director of CDC Africa, the African Center for Disease Control and Prevention. Now you are the coordinator of the United States AIDS program, and at the same time the boss of the Bureau of Global Health Diplomacy. What does your new job entail at the State Department?
Yeah. So first of all, let me say that on August 1st of this year, Secretary Blinken launched a new bureau within the State Department called the Bureau of Global Health Security and Diplomacy. And what that bureau does is that it folds in the fight against HIV/AIDS under Pepfar into that bureau, and then it brings in all the health security units and offices within that bureau. The goal of that is really to elevate global health security as part of the foreign policy of the United States and diplomacy, is to leverage the assets that we already have in the field. You indicated at the start of this conversation the billions that we are putting in to fight malaria, TB, HIV in the world. How do we leverage that to guarantee security, health security? I've always said that the best way to invest in the unknowns is to invest adequately in the knowns. So investing in the fight against those common diseases is so important. And lastly is to make sure that we enhance our own, we recognize that global health security is national security. COVID taught us that. So that's what the new bureau will try to do. But very importantly is to work with the concept of what we call the 4 Cs, to cooperate, to coordinate, to collaborate, and to communicate with other countries and within the United States.
One but last question. When you were at CDC Africa leading the fight against COVID-19, we spoke about that abundantly in our previous conversations. How did the various leadership positions you had in life helping you today to manage policy execution at the State Department?
I'm a virologist by training, and you grow into that by just doing the assignments that you have to do, and you move into policy space. And at some point, it gets you begin to triangulate both technical, programmatic, policy, and political maneuvering to solve the problem. It's always about what is the problem or the challenge that you need to solve. At the AU at that time, at the height of COVID, it was COVID. What do we do to prevent 1.4 billion people in Africa from dying of COVID? So that was my responsibility. So you had to know how to pull in the political leadership, the policymakers, the programmatic people, the technical people, all together, so that we work together to solving the problem. And that experience is applicable to any situation that you face in solving big problems, especially global health security challenges across the world.
In August last year, where you are seated in this same place, my guest was the current U.S. ambassador to Cameroon. And in the course of my conversation with him, I mentioned your name, and he said you are one of the Cameroonian-born Americans, making Cameroon and the United States of America proud. When I have to roll back your life, born in the hinterlands of Libialem Division in the southwest region of Cameroon, studied in then Ole University of Yaoundé, went to CDC Africa, today confirmed by the U.S. Senate, one of the most important institutions in the world, nominated by an American president, considered by all as the most powerful president on planet Earth. What message do you have in particular to the millions of young people of your country of origin?
A very good question, Charles, and very difficult question. And I would think that I would start off by being thankful to the education that I received in Cameroon, and somehow was always tied to the United States government support. I went to the high school in Kumba, called Kaskumba. I don't know what it's called nowadays, but
it's still Kaskumba.
Kaskumba. And my science teachers, they were Peace Corps, were American Peace Corps. So they shaped the way my thinking in science and the discipline. I remember
just like myself.
Yeah, just like yourself. So I really want to recognize that. Then the University of Yaoundé, which I will be honored to give a lecture in the coming days, grounded that and really started teaching me how to think more broadly, because that is the purpose of university, is the seat of wisdom, right? And the basics of your academic growth. Now, the rest of it, back to your question, is what I call the unpredictability of professional life. It is very difficult to map out how you move from point A to point B. But what I do every day, and I like to encourage young people to do that, is that when you are trusted with an assignment to do, you do it the best you can. That is the only ingredient that takes you to the next level. You do it with integrity, you do it with honor, and you do it with passion. That is the only thing that I can encourage young people to lead with, which says, instead of plotting today how you get to that next level, you do the work that you have to do today and do it well. If the work you have to do today is to prevent HIV/AIDS in the community, be the best HIV prevention expert in the community. If the work you have to do today is to provide treatment in the hospital that you are overseeing, be the best in providing that care. That's the only ingredient that takes you and prepares you to the next level. There's absolutely no textbook that tells you that, well, to be an ambassador at large at the United States, you have to do the 4 things that mean, and no, it doesn't exist.
Absolutely.
It only has to do with, do you deliver on the trust that the community has given to you? Any job that you and I do is a trust of the community that they give you. The trust of the community means your institution trusts you, Charles, that you can lead this program and you do it your best. That's the only advice I will give to the young people.
Do you have any message of thanks, appreciation to your former government, the government of Cameroon? You grew up here. Do you have any message for them?
I grew up in Cameroon, as I've said, to the age of 24. And after completing the University of Yaoundé. And at that time, when we went to the University of Yaoundé, we had a scholarship, a stipend of about 30,000.
Not for my generation.
CFA. I'll come back to your generation. And that was the equivalent of about $50, right, a month. But that was a lot of money. Okay, a lot of money could make you pay your rents and buy your tickets in the restaurant. And quite honestly, and there was no tuition. I mean, I would just add there. I mean, all you just needed to do was to get your grades, and then you get that support, which is no tuition, and also have a stipend from government.
Okay.
Now, I don't know about your generation. I left Cameroon in 1988, so I don't know what happened after that. But the point I wanted to make is that, given the humble beginnings that I come from, if the government of Cameroon didn't enable that period, both high school, to go to high school where you didn't pay a tuition and go to university, or what the Americans would call college, without a tuition, I wouldn't have been able to make it, go through that, because my parents were not able to afford that at the University of Yaoundé. So for that, I'm eternally grateful for that opportunity. And I encourage the young people to seize every opportunity to go to learning, to go to university and study. Is the only equalizer. And it's the only thing that gives you that stability as you climb up your social life, education.
And with that, we conclude the interview on education. U.S. Ambassador at Large, Coordinator of the United States Program on HIV and AIDS, Dr. John Nkengasong, thank you very much indeed for talking to us once more on CRTV. And I want to thank the entire staff of the U.S. Embassy in Yaoundé, Cameroon, for always making sure that my conversation with U.S. officials are possible whenever need be. Thank you.
Thank you. Thank you, Charles. Thank you.
You're welcome.